Hi, I'm Karan Gandhi. I'm a hepatopancreaticobiliary, or in short, an HPB surgeon, working at the Aga Khan University Hospital, Nairobi. I'm 38 years old currently, but I qualified as an HPB surgeon when I was 35 years old. And I'm a general surgeon in addition to being a hepatobiliary surgeon as well. I started my journey of medical school back in 2009 when I actually finished in 2009. I started in 2004 and I graduated from medical school at University of Nairobi in 2009, after which I was an intern at the Aga Khan University Hospital, and subsequently I went to South Africa for my training in general surgery. It's a specialist training which took about 5 years. And after that, I was fortunate enough to get a position in the subspecialty field of hepatobiliary surgery, or hepatopancreaticobiliary surgery. So it's a long name, it sounds very complex, but it basically entails surgery and treatment of surgical conditions which involve the liver, the biliary tree, which includes the gallbladder, and the pancreas itself. So it's a very complex and intimately related system. And the disease processes that affect these organs can range from benign or non-cancerous conditions to malignant conditions or cancerous conditions. And part of the subspecialty training was geared at equipping me to basically treat these conditions from a surgical point of view. It involves not only surgery but endoscopy and advanced procedures with less invasive nature. As part of my general surgery training, we were also exposed a lot to laparoscopic or minimally invasive surgery. So that, in a nutshell, just encompasses what I do as a hepatobiliary surgeon. So it's quite hectic in some ways, if you consider it, because what we have to deal with is a variety of patient populations. So we can deal with patients who are admitted in the ward under your care, and obviously on a daily basis, regardless of whether it's a public holiday, weekend, we have to do ward rounds, and I make it a point to see my patients every day on a ward round. So ward rounds is a major part of the day, and it depends on how many patients you have admitted in the hospital at that point in time. Apart from that, there are other clinical duties to take care of. For example, outpatient clinics, where you have patients who come to see you by appointment, and you can actually sit in those meetings, in the clinic, and have patients consult you over there. And apart from that, we have surgeries that we need to do. So surgery would involve being in the operation theatre, and we have what we call elective surgery or planned surgery, that you've seen someone who needs surgery for a particular reason, and you book them in, and they have the surgery on that day. So I have specific days in the week where I do elective surgery, but you can have emergencies that pop up at any time, and that's very unpredictable. And then it depends on the availability of theatre or how critical the surgery would be, and then I might have to do an emergency surgery, and that doesn't come at a specific time. It may come in the middle of the night, it may come at any point during the day as well. Apart from surgery, we also do quite a bit of endoscopy in the field. So there's a specific procedure known as ERCP, and a lot of interventional endoscopy for patients who have various conditions. For example, jaundice, whether it's jaundice related to a cancer or it's jaundice related to gallstones, we have to do surgeries or endoscopies for those. Other kinds of endoscopies for things like acidity and those kind of conditions can also be done. And in addition to that, I'm quite involved in academics as well. So we do train and teach postgraduate students at the Aga Khan University Hospital. But aside from that, I'm also involved in a multidisciplinary team meeting at the Kenyatta National Hospital, where we meet once a week. And so we have Tuesday morning meetings over there, and various other Zoom meetings or other academic sort of settings where we meet and discuss difficult cases, and we have multidisciplinary team meetings. So it's quite variable, and it can be day, it can be night. Some things are planned, some things you don't actually get to attend because an emergency comes and disrupts everything that you have to do. In one word, I would say it's very humbling to be nominated for this, because in as much as we do what we do. You know, it's nice to have that work recognized, because nobody does this for recognition per se. You do it because it's a passion, and you just want to make people's lives better. It's very, very humbling, and when I received an email about it, I think I know who nominated me from the email, but it was very humbling. At the same time, it gives you a sense of satisfaction to know that your work is actually getting recognized, and people are realizing what you're doing. I think for me, one of the most important things is that hepatobiliary surgery in Kenya is very much in its infancy stages, and not many people are aware of this field of surgical practice. And in that sense, it also gives me a lot of pride. And as much as it's humbling, it gives me a lot of pride to realize that this is actually getting known, and the work is getting recognized, and hopefully I can use this platform to actually benefit a lot more Kenyans than I can at the moment. Hepatobiliary surgery is very much in its infancy stages. Not to say that I'm the only person doing it in Kenya. There are a lot of people before me, my seniors, other consultants, who have really been pushing the field and trying to make advances or progress in the field. But I am in a unique position, and I'm very fortunate, I think, and blessed to have been able to be trained by one of the best in the world in this field. And I'm also uniquely placed to be able to bring that skill back home, because what happens is we often lose a lot of talent to the diaspora, and we have people who are well trained and they go out and they leave the country, and then we don't have that much or that many people coming back to actually benefit our local community. So in terms of my work that stands out, I would say that what I'm trying to do in Kenya is help to build up from where my predecessors have gotten it to. And uniquely also, I have the advantage of being in contact with some of the people in South Africa and my mentors. So what we can do is basically set up international collaborations with them and translate that into better care for our patients. I'll give you an example. I spoke about a multidisciplinary team meeting that we have at the Kenyatta National Hospital. So every Tuesday morning we meet virtually, and we have patients with specific hepatobiliary conditions that we discuss. So someone has seen the patient, you get a history, you get an examination, we look at the imaging, for example, the radiology, CT scans, and then given all this information, we make the best decision plan going forward for these patients. Hepatobiliary surgery is very challenging and very complex in terms of the pathology that we deal with, and having a multidisciplinary team this way, where you have a surgeon who's an expert in the field and you have a radiologist who's good at looking at the images, it helps give much better patient care, because everyone tends to be on the same page and you have a holistic sort of approach to the treatment of the patients. We do that at the Aga Khan University Hospital as well. And now what we've done with my mentor in South Africa and some other teams across the entire sub-Saharan Africa is set up multidisciplinary team meetings for sub-Saharan Africa as a whole. We started off with discussing specifically liver cancer, but now we're expanding this into all hepatobiliary conditions, for example, pancreatic cancer, liver cancers, bile duct cancers, and other benign conditions as well that may be needed to be treated. In addition to that, it also helps to teach our junior colleagues as well. So I'm, again, lucky to be in an institution where we have a training program and we can train upcoming surgeons. In addition to that, the surgeons at Kenyatta National Hospital, and even we have COSEXA programs where I'm quite involved with teaching. I think the teaching itself is quite a unique thing, because a successful teacher is someone who can make a student more successful than him, you know. So if I can help bring people up and expand this level of care to the rest of Kenya, and we can have people who are not only centralized, but we can have people from all over the country benefit from learning and translate that into better patient care, I think that's what the goal is, and that's where I think it puts me at a unique position for this.